Festivities are always characterized with a lot of merrymaking, and it is against this background that the Uganda AIDS Commission has urged the population to refrain from risky social engagements that can lead them to contract HIV. This concern by Uganda AIDS Commission comes at a time when there are 52,000 new infections recorded annually, with the young people accounting for the highest numbers.
Festive seasons around Christmas is a season of high excitement where people engage in high-risk sexual behaviors, including sex with multiple sexual partners, forgetting to use condoms, and people consume a lot of alcohol. We know that when people consume a lot of alcohol, their self-control reduces and engage in high-risk behavior. So we are prepared to make sure we save our people from contracting HIV. Number one, we must continue spreading the message of prevention. HIV is still real. Last year we had 52,000 new HIV infections. Those are still high. So those of you who think there is no more HIV, this is to tell you that HIV is still real in the country. Number two, we have put measures in place to make sure you don't contract HIV in case you engage in sex. We have ensured and mapped across the country all spots where high-risk sex usually takes place. So we have made sure that there are enough condoms across the country. So all of you who are going back to the villages in your communities, you'll find a continuous supply of condoms.
Uganda AIDS Commission is also concerned about the sustainability of HIV financing, and therefore different approaches are being sought, like strengthening the $1 initiative.
And we are saying out of the 40 million, if everyone contributed $1, that would be a lot of money that this country can generate and use for this HIV response. And it is there. And we are partnering with MTN and Airtel to be able to get this money through mobile money. So you don't have to walk to Uganda AIDS Commission or the private sector entity that is managing this program, or UMA, to pay the 4,000. You use your mobile money and you can decide to send 1,000 a quarter. So it's not like all the time you have to have the 4,000. You have 4 quarters in a year. So pay 1,000 every quarter, because MTN generates this information, or Airtel will generate this money once in a year after it has been collected for the whole year. So we are creating a system where the whole public can actually see how this money is generated from these entities.
Uganda has an estimated 1.4 million people living with HIV and 700,000 million US dollars, approximately 4 trillion Uganda shillings, is spent on running HIV programs annually. Adia Nakute, UBC.